Brought to you by Tailored Wealth, helping business leaders live their version of a rich life.
Welcome to another edition of the Making Sense of Your Money podcast, where we cut through the financial noise and help business leaders to make smart, confident money decisions. Hello and welcome again to the Making Sense of Your Money podcast, where we help you take control of your finances, minimize uncertainty, and maximize your wealth potential. I'm your host, Dan Pascone. I am the founder and CEO of Tailored Wealth. And today I am excited to introduce and bring on a special guest. We've got with us Mark Fox, who is the owner and president of CBG. Mark is in the healthcare space, and him and his firm are doing some really nice and innovative things there. So Mark, thanks for joining the Making Sense of Your Money podcast, and we're psyched to have you today.
I'm glad to be here. Thanks for having me.
You bet, man. You bet. We're going to have some fun. We've got a lot to cover, and I know that our audience would love to kind of get your expert take on some key topics. So let's jump right in. First and foremost, give us a quick 90-second overview of what your business does, and then tell us a little bit about how you got into it as well.
Yeah, sure. Well, I'll start with how I got into it. I'm going to flip it on you only because most people get into the insurance space by accident. It's typically not on purpose. I think there's only one university that offers a master's degree in our space in the entire country. So it's a little bit unique. It was by mistake. I really was searching for a solution for Americans when it comes to healthcare. And that's kind of what led us to what we do today. So I'll get into that. We build custom plans for employers. That's the most simplest way of putting it. We're bringing together the provider, the doctor, the hospital, and the patient, and we're getting rid of all the middle people. There are a lot of them. And so by doing so, we're increasing the quality of care and reducing the cost significantly. And it starts at the employer level. So we're really excited about how we're making change in America. We're literally seeing the landscape of healthcare change dramatically. I'll talk a little bit about that later on, but it's really exciting to see how we're making an impact, not just from the employer level, but also to the individual pockets of the employees. Super excited.
Awesome, man. Awesome. That's a great story, and I'm excited to learn more about that. Tell us, if you don't mind, tell us a little bit about your ideal client and then what you ultimately help them to do in the healthcare space.
Yeah, so our ideal client is the CFO, CEO, HR director who realizes that their current spend in healthcare is unsustainable. It's also unpredictable, and they're tired of the big insurance companies hiding their data. Those individuals recognize that change is needed and that they need to provide a better service to their employees. They recognize that their employees rely on them to make good business decisions. And so we're looking to partner with those types of individuals. There are types of individuals out there that see healthcare as a speed bump. They just hit that renew button every single year. They're not really looking for change, in which case we're not really a good fit. So we're looking for those who are looking for change and want better results.
And once they find you, the CFO, the HR director that is looking for that change with respect to their healthcare offerings, what do you ultimately help them to do? What do you typically find as like the end result once they engage with you?
Yeah, so we walk them through the initial stages. We start with, can we help you, right? And we look at your plan from a macroscopic level, and receive a little bit of high-level data and then find out where is your plan headed over the next 5 years. We compare that to where the industry is and also the results of what CBG can do. And so we can see exactly where that gulf is. Is that savings metric make sense for change? Or is it budget dust? So we do that for free initially. Then if that savings number looks very attractive and looks warranted for change, then we go into the build phase, in which case our clients sign a letter of engagement. We charge a very small fee to build a custom health plan from the ground up. This is not taking the census and just shopping in it with all the insurance companies out there. There are a ton of brokers who can do that for you. You do not need us to handle that. We are building it from scratch. It is very customized and it's specific to your organization, where your employees are located, your goals, etc. And once we build that plan, we also guarantee the results. So if we don't hit our savings metrics, we refund our initial consulting fee. If we do hit our savings metrics, but you decide to implement the plan that we build, we still refund you our fee because we charge a flat per employee per month fee to manage the plan that we build for you. And we guarantee those savings metrics result. There is nobody in this industry that has a guarantee, not that I've seen anyway. They don't use the word certainty or guarantee or predictability. They can't. They always use the words, well, it depends. So we start with that is, can we help you? We walk through the build phase, and then comes time for the big decision of, do we implement this plan? So that's kind of the process we take.
Yeah. And so my next question was going to be what makes you unique, but I think you kind of hit on that, Mark. I haven't heard of others that are going to this sort of level of depth to customize a plan and or give any form of guarantee. How are you able to do this, and kind of what made that fit for you and made that right for you and your business, and ultimately what you help your customers accomplish?
Yeah, I'll start with why. Because if we don't do something, who will? The world of healthcare is getting worse. We spend 20% GDP almost on healthcare, and it's getting worse.
Yeah.
You know, just talking about the kind of the problem for a second. I mean, you've got the United States spending twice as much than other first world countries. The World Health Organization has us ranked at number 37 on quality. Costa Rica has us beat at number 36. So we're not getting what we're paying for. So that's kind of the why behind why we're trying to help employers out there. But going through that process, I apologize. What was the first part of your question there? I want to make sure I answer that.
Yeah. Tell us a little bit about, how you're able to do this level of customization for your clients that maybe the others that are in your space aren't doing.
Yeah, that's a good question. Okay. So the reason why we're able to is because the bar's really, really low. And our business model is 180-degree difference. You have large broker firms out there, insurance firms, who work off of commission, and they actually get a bigger paycheck for doing a bad job. What do I mean by that? They get paid more when they deliver a renewal with an increase. I don't find that to be an aligned incentive, and I don't think most employers would either. But yet we hit the renew button every single year and just accept it. So since we don't work off of commission, we're able to guarantee the results because we're getting rid of the middles that are fluffing this thing and making it expensive. That's why employers are getting these 20% renewals, 30% renewals, because everybody in the middle of the plan gets paid more for doing a bad job. Think about, the surgeon who leaves a tool inside of the knee. They get paid again for going in and getting that tool. Absurd. So with our plan design, and since we're not trying to keep shareholders happy, we're able to get rid of those middles and realign the incentives. That is the number one thing, is with every health plan, you have to have aligned incentives. And as a consultant, we sit on the same side of the table as the employer. So when they win, we win. That's better.
Makes a lot of sense. Big fan of that approach to aligning the incentives. I think that's always a good business model. Mark, tell us a little bit about the top challenges that your clients face when you start a new engagement, and then maybe a little bit about how you help them to overcome those challenges.
Yeah, so the top challenge is going to be data. The big insurance companies are just hiding everything. They don't want to know want you to know what you're spending and what you're spending it on.
Yep.
And they hide behind HIPAA. They say, HIPAA, we can't give that to you. Sorry. That's a load of crap. Sorry, I'm not sure if I'm allowed to say that on here, but it is.
You are.
Because employers have a fiduciary responsibility to make sure plan assets are spent prudently. Just like on the financial side, right? You have a set of rules that determine whether or not this is a good decision or not for the employees and as the plan as a whole. So to say, HIPAA prevents us from sharing what you're spending your money on is just a giant screen. And they've been winning that game for decades. And that's the reason why premiums keep going up. If you actually knew what you spent your money on, then you'd be able to do something about it. You'd be able to shop it. You'd be able to find a better supplier, more efficient, lower cost. So that's the number one hurdle, is the lack of transparency and data. And then the next hurdle, the second most important, would be, okay, once we fight and we get our data, what the heck do we do with it, right? How do we actually act on this? I see wellness companies all the time providing these services and getting data for these employers. And they're like, great, now we know exactly where our money's being spent, and they do nothing with it. They sit along the sidelines. And so what we do is we bring in high quality providers and solutions into the plan to utilize that data, and we attack based on where your plan spend is. We had an employer, I'll give you an example, who was spending a lot on emergency room cases. Emergency is one of the hardest types of claims to mitigate because you never know when it's going to happen, and you can't pre-negotiate it with, a random ER center. Whereas a planned surgery, much easier. You can pre-negotiate that because you know when it's going to happen and what needs to happen. So we were able to put in a solution that reduced their costs by 80% on emergency room claims. And the employees paid nothing, by the way, during those emergency claim visits. We do use a kind of a stick and a carrot approach where the employee still has all the choices that they're used to having, but standard deductibles and copays apply. If they're smarter about how they're consuming healthcare, they pay zero.
Okay. Makes a lot of sense. Mark, how do your clients typically find you?
Yeah, so it's pretty difficult actually because there's such a big blue ocean out there, and you have Cigna, Aetna, Blue Cross Blue Shield, and United controlling the market. So a lot of times they either hear about us through one of our marketing outreaches, like an ad or something like that, or they'll find out from one of our current clients. That's typically how we get in contact with new employer groups. And then we sit down, we just have a conversation with them, much like this, just kind of figuring out, okay, where are you? Where have you come from? Where are you trying to go? What's your goals? Is it potentially that we could be a good fit? Vice versa. So we look at working with employers that have 100 employees or more. What we do today, we used to do for smaller employers. This strategy works for employers that have low as 30 employees. We actually still have some legacy accounts that have between 30 to 50 employees and are saving a lot of money through this custom strategy. For CBG though, for us to go up market was wise. We had more solutions to be able to offer, and it also allowed us a greater negotiation ability with the different providers, hospital systems, things like that, when we were bringing more lives to the table.
Makes sense. One of the things that we try to identify here, we've got a lot of different professionals that tune into this podcast in different spheres of financial services and business. Do you collaborate with referral partners at all? And if you were them, why would they consider a referral partnership with you?
We do, yeah. So we have to spend money on marketing some way, right? And time. So we do work with referral partners. Some of them are very unique. We have a traveling nurse that refers organizations to us. We have an evangelist, a preacher who knows a lot of people, who has referred business to us. We also have individuals in the legal sector who understand kind of the workings and the politics of the healthcare industry, who have referred business. And you know what's strange is some of the best prospects are actually hospitals, because they don't understand how huge of an impact that they can have on their community. So we fix the plan for the hospital, and then we go local, right? We relocalize healthcare in that area.
Interesting.
And we have an epidemic in America right now with hospitals in rural areas closing down left and right because they can't compete with the nonprofit hospital that's 2 to 3 hours away. Right. With our plan, they can, and it succeeds substantially and drive revenue while also saving their local community a ton of money. So they just don't know how to have that conversation or how to organize that, and that's where we come in.
It's a lot of sense. That's a nice segue. Tell me, where do you see your industry going in the next 5 to 10 years, and how do you plan on staying on top of it?
Yeah, so this industry changes every day. Especially depending on who's elected. You know, there's been a lot of talk about single payer, which will never happen. It's a nice term people talk about, and it's a hot topic, but for a lot of political reasons, which I won't get into, it'll just never happen. So I really think that, Dan, I apologize. I'm just having a little bit of a brain fog here. Can you repeat your question so I can make sure I get it right? I had a thought and I lost it.
All good. Where do you see the industry going in the next 5 to 10 years? And tell me how you plan on staying on top of it.
Yeah. So the industry is changing significantly, but for the better, I think. We're seeing more transparency. So for CBG to stay on top of that is just making sure that we're in the trenches every single day. We're looking at ways to solve problems. This is a pivoting type business, meaning that if we come across a new issue, we find a solution for it, and there always is one. We just have to find it. So this industry does change significantly. We've seen a lot more transparency. The problem is employers just didn't know how to use that data that they can get now that they couldn't get 3 years ago. So politically, I think things are pretty interesting depending on who's in office, but I think staying on top of where do we spend our money and how do we address it? So if it's cancer, what kind of cancer solution can we put in? If it's specialty medications, what kind of specialty medication solution can we put into our plan to help mitigate that cost? Those are the questions to ask. How do we mitigate the frequency and severity of our claims? If we can solve for that question, we'll solve for healthcare in America.
That's really Powerful statement. Very well said. All right, let's transition a little bit. We're going to start to talk about you. I've got one question before we get into our lightning round. What's
Sound
the
good?
biggest challenge, Mark, that you've faced to this point in your life, and how has that helped you shape the way that you do business?
Yeah. So the biggest challenge in my life, I think, is probably just being seen as too outside the box.
Okay.
Right? Too innovative. And it's never been done, so it can't be done. And so kicking against the pricks on that has been challenging. And so when it comes to business, early on in our company, it was a struggle because no employer wanted to be the first one. They did not want to be the guinea pig. So we had to have results. And once we got a few years under our belt and we showed significant savings, results, and better benefits and higher quality care, employees back at work, more productive, more loyal, we were able to take that story and run with it. And so we've seen a lot more employers now taking advantage of it. But it was an initial hurdle, that initial, who's going to be the first one, right? Of getting over, the different changes and the different challenges that they were seeing within inside of their health plan. And who is this CBG, right? They're doing things different. I don't know about that. If it's that good, everybody would be doing it, right? We got that several times. But we've been able to overcome that now since we've gotten the results. And that's why we guarantee the results, right? Because it shows employers that, hey, this is a no-duh business proposition.
Yeah, albeit a very different business. We've used a similar business model where we really try to de-risk the initial engagement so that folks see the results without having to take on a ton of risk. And then to your point from there, once they see the results, it's just a compounding and a snowball effect. Yeah. So I'm definitely on board with you there. And kudos to you and your team for innovating because I think it's the right way to offer any sort of business service in this day and age. All right, so now we are at the lightning round, Mark. So we're going to have some fun with this. So this is pretty simple. You're just going to give the first answer that comes to mind, and we're going to get to know you a little bit better.
Sounds good.
All right. Coffee or tea?
Coffee.
Cats or dogs?
Dogs.
Okay. What's one tool or technology other than your computer or your phone that you can't live without?
AI.
Okay. All right. Me too. Favorite quote or phrase about money, business, or success?
That's a tough one. There are so many out there. Yeah, I really don't know because there are so many different items that we could pick. I might have to take a pass on that, but I'll say this. I've had a lot of mentors in my life, and that is the only reason why we know how to do what we do today is because we've put the right mentors in to be able to teach us various avenues of business. So I think making sure that you have the right mentor is super important, whether that's in book form, like the stack of books I have behind me, or it's, physically face to face.
All right. Well, that's a great segue to my next one. Favorite book on business or success?
Man, that's also a really hard question. There are so many. I'll just go with the most recent one that I read, which is Extreme Ownership.
Yep. Yako.
And I'm right in the middle of that sequel right now, The Dichotomy of Leadership. So
The Economy of Leadership is on my list, actually, so I'm glad you mentioned that. I read Extreme Ownership many years ago. I actually saw him speak a couple times as well, so those are good ones for sure. Those are good ones. Any personal productivity hacks you can share?
I actually really struggled years ago on being organized and staying on top of being productive. And, then I read this book called The 80-20 Rule, right? Which is another great book to bring up. So, and then I also had another coach who helped me understand that you have to identify your greatest weaknesses and work on those. And my greatest weakness was being organized. So I would say the greatest hack right now is AI because it is so powerful and it can help you stay so organized and automate repetitive tasks that you just don't need to be doing. So I find myself using AI multiple times a day, not just with tasks, but also with teaching me new things. I would say if you're not using AI, I sure hope you're already retired. Because if you're still working right now and you're not using it, you will be left behind or your job will get replaced. There's a big statistic out there right now. It's talking about how AI is replacing like a third of transactional jobs out there by the next 5 years. So I'm really scared for those types of individuals who aren't dialing into it.
You a Chat GPT guy, Claude? What's your go-to AI source today?
Yeah, usually Chat GPT, but there's a lot of them out there. A lot of different models, long models, short models. It depends on the task. I think you have to be very intentional on which model you're using based on the result that you're trying to get and what task you're trying to get it to do. But yeah, usually ChatGPT is my go-to. Our organization has AI used significantly to help service our clients. For example, we have a couple different departments, but one of them is our support team. It will analyze when a support ticket comes in and give a synopsis of that ticket to our agent and make a recommendation on a potential reply. And then we don't typically take that reply, but we take its recommendations and then we mold it specifically to what we need it to say. And it's helped significantly because if we're reducing the amount of time on repetitive tasks, then we can be on the phone more with clients and having real conversations with them and walking them through anything that they're working on or they need.
Very cool. Love that. Love that. What's one bucket list item you've already accomplished?
Okay. I've got a fun one for you. So I love bucket list items. So one of my bucket list items was to get invited onto a yacht by a stranger, and just have a good time, So, and me and my wife were at a restaurant, and we actually didn't have our son with us, which is a rare occasion. And it was a waterfront restaurant. We got to know these individuals who were professional tennis players, and they pulled this very large yacht up to the restaurant, and they invited us to go with them. And so I'm more of the extrovert in the relationship, and so I had to kind of sell my wife on, hey, this is a bucket list item for me. We really got to do this. So she was like, well, where are they going to go? What if they drop us off somewhere randomly? That I'm like, we'll figure it out. Like, this is like amazing race. We're good. We'll find a way back home, And we got to know them really well. We did get on the yacht. They didn't actually end up going anywhere. We just had a good time right there on the yacht for several hours and had a fun time. So that was a bucket list item that was accomplished and checked off, I think about 2 years ago now.
Wow, that's very cool. That's a different one. I've asked this question a bunch and I haven't heard that before. Yeah. Get invited on a yacht by a stranger. Very cool. Honey, we got to do this. It's on my bucket list. I think I'm going to use that moving forward. For a lot of different items. What is one business or financial milestone that you're still working towards?
Yeah, so business milestone would be to actually open up a second company that's completely unrelated to this industry. That is still yet to be accomplished because I felt like CBG needed more of my time right now before it can fly completely. And I would say, when I say completely, I really mean like 90-95% on its own. And so we're still in that process and will be for, at least the next 3 to 5 years. But there are 2 to 3 other companies that I think would have a big impact on America that are different and not in this industry.
Very cool. Very cool. I look forward to following that journey with you. Last one, if you could give one piece of advice to your younger self, what would it be?
Get a mentor faster. Find out who the expert is in this field, and be at their side 24/7 as much as you possibly could, whether you're reading their books or their articles or physically getting together with them and paying for their mentorship. I wish I had done that. I actually, side note, I owned my own agency in the traditional sense of insurance years ago. I sold that business and worked for a larger company. During that time, I learned a lot, but I had to learn it the hard way. And it took a long time to generate decent revenue. And had I just put myself and humbled myself and got a mentor and started learning that I don't really know everything, and getting someone who knows a lot more than me to teach me some ropes in all aspects of business, not just in the healthcare industry, we would have been in this area of our lives and in our business much sooner. So that's what I would have told my younger self.
Very cool. Very cool. Good advice. And I could not agree more with that one. And I definitely would have told myself that earlier on. All right, Mark, finally, if our listeners want to connect with you, collaborate, work with you, learn from you, what's the best way to reach out to you?
Yeah, you can reach out through our website, cbghealthplan.com. That's cbghealthplan.com. Or you can shoot me an email and I'll route you to one of our team members, or I'll work with you directly. And my email address is mark, M-A-R-K, at cbghealthplan.com. That's mark at cbghealthplan.com.
Very cool. Very cool. We will put that in the show notes as well. Mark, great stuff today. Really enjoyed it. Thanks for sharing your time. Thanks for sharing your insights, your wisdom, your experiences, getting a little vulnerable with us. We appreciate that. So thanks for being on the Making Sense of Your Money podcast.
Thanks so much.
All right, everybody. This is another episode of Making Sense of Your Money with Mark Box. Cheers and have a great one. Awesome, dude. That was fun.
Hey, sorry I lost my train of thought a few times there. I apologize about that.
Dude, it's honestly like, and again, I'll leave